In this video, I'm going to walk you through an exercise program for snapping hip syndrome. There will be exercises and stretches here that will be suitable for both internal and external snapping hips. And if you're not sure which one you might have, or even if you actually have this condition, then do check out this video where I'll go through all the details of snapping hip syndrome, including the different types, what causes it, how it's diagnosed, and what the treatment options are, in addition to the exercises I'm going to go through right here. I'll also put a link to that video in the description, so if you need to, then go and check that video out first, and then come back here and we'll go through the exercise program. So first up are a few stretches that can help reduce tension in the muscles involved in snapping hips. For external snapping hip syndrome, stretches for the gluteal muscles can be helpful. I'll show you 3. Try each and see which one feels best for you. They shouldn't be painful. They should feel like a comfortable stretch in the buttock region. The first is a simple stretch in sitting. Cross one leg over the other. So this is a stretch for my right-sided glutes. Keep a straight back, slowly lean forwards until you feel a nice stretch in the buttock area. Hold for about 15 to 30 seconds. The next one is done in kneeling. Again, I'll show you the stretch for the right side. First, take your right knee over to the left side, and then the left knee crosses over the right side like this. Now, just slide your right knee backwards until you feel the stretch. The last one combines a gluteal stretch with a balance exercise, and it's the one that I prefer, if you can manage it. For the right side, cross your right foot over your left knee like this. Then slowly go down into a sitting position. Stop when you feel a comfortable stretch in the right buttock. For internal snapping hip syndrome, stretches should target the hip flexor muscles. One of the easiest ways of doing this is in kneeling. The hip to be stretched goes in the backwards position. Now keep upright and then rock forwards onto your front foot while keeping your chest and shoulders back. You should feel a nice stretch in the thigh or groin region. Lifting your arms during the stretch can help increase the tension if needed. Another way of doing the same type of stretch is in standing. Grab hold of the foot of the leg you're stretching, bend the knee fully, and then slowly push the hip forwards while keeping your chest back. Feel the stretch in the right thigh and groin. As with the glute stretches, hold for about 15 to 30 seconds and repeat 3 or 4 times. Swap sides if needed and try to do them a couple of times daily. Now, you might see some people recommending specific IT band stretches for snapping hips, but research has consistently shown that the IT band just doesn't stretch. And indeed, if you've ever had the opportunity to see and feel one in an anatomy lab, then you'll see just how tough and inflexible the IT band is. No amount of stretching is going to affect it. So, IT band stretches are just going to stretch the gluteal and tensor fasciae lata muscles which attach to it. So therefore, you might as well just do the stretches that I showed you earlier, as they will be far more effective in stretching these particular muscles. Okay, now let's move on to the exercises, which are of course the main part of the treatment program for snapping hips. I'm going to show you a variety of different exercises, so try each of them and see what suits you. You probably won't need to do them all. They're going to be suitable for both internal and external snapping hips, although some are going to be more suited to one than the other, and I'll explain that as we go along. The golden rule with all of them is that they must not cause the snapping. If they do, then try to do the exercise in a way that doesn't cause a snapping, or just don't do that particular exercise for the time being. Try some of the others instead and come back to the other ones later down the line. There will always be some that you can do that don't cause snapping. Overall, all of these exercises should be fairly pain-free. So first up, is a simple clam exercise which works hip abduction and external rotation, so the sidewards and outwards movements of the hip. And so these will therefore be a bit more suited to external snapping hips. So we're in side lying with the affected leg uppermost, knees flexed and knees and ankles stacked on top of each other. Now, slowly take your upper knee off the lower one while keeping your ankles together. Try to keep your pelvis stable. Don't let it rock backwards. If you do get a snap at a certain point, then stop just before the snap. Don't cause it. Hold the end position for a few seconds, then repeat about 10 times and do 2 or 3 sets. If you can do this easily, then use some resistance band across the knees and adjust the tension so you can manage 2 or 3 sets of 10 repetitions. Pure hip abduction is also important in external snapping. You can do this in side lying like this. But hip abduction is generally best done in standing. This one is a static exercise where you simply push the foot of your affected leg outwards into a wall and apply some pressure. This can be a useful exercise if you can't do the other abduction exercises without causing the snapping. Hold the pressure for 5 to 10 seconds and then repeat 5 to 10 times. Then do 2 or 3 sets. To progress this further, you can do active hip abduction in standing with some resistance band. Side-to-side walking with the resistance band is a further progression and works the gluteal muscles really hard. 2 or 3 sets of 10 repetitions is a good start for these exercises. Next is the side plank. This is another exercise slightly biased to external snapping hips and is particularly good for hips which might snap during some of the other exercises, as essentially no movement occurs during this exercise. Just try and keep a straight line through your hips and spine. The only point of contact with the floor should be your lower forearm and elbow and your ankle. Hold for up to 30 seconds and then swap sides. Repeat 2 or 3 times. The bridge is another great exercise for the pelvic muscles and is great for both internal and external snapping hips. Lift your pelvis up to a comfortable position and then hold for 5 to 10 seconds. Repeat 5 to 10 times. To progress, do a slow march while trying to keep your pelvis nice and steady. Try 5 to 10 steps and then rest, and then repeat 2 or 3 times. You can also do the same bridging exercises with some resistance band around your knees. This next exercise is for the hip flexors and is therefore more suited to internal snapping hips. Use a loop of resistance band around both ankles, then take one knee upwards towards your chest like this, slowly up and slowly down. You can also do this exercise in standing like this. Repeat 5 to 10 times and do 2 or 3 sets. Now, these next ones are the functional exercises and are suitable for both internal and external snapping hips. The first is a simple squat. Keep your back straight and your feet flat on the floor. Now, just go as if to sit down. Go as low as you can without causing pain or any hip snapping, and then slowly return. Start with 2 sets of 10, but try to build up to 3 sets of 20 over the coming weeks. To progress, add some resistance band around your knees and then try to keep tension on the band throughout the exercise. You can also do the squat with some weight added. I'm using a kettlebell here held up to my chest. This is called a goblet squat. On a similar theme is the hip hinge. Now, this might look similar to the squat, but it's not. The idea here is to focus on the pelvis and hip muscles. I've got a stick in my hands and I'm keeping my back straight. I'm sliding the stick down my thighs, over my knees and onto my shins. I'm sticking my backside out as far as I can. So you can see here that the squat is more of a knee exercise, whereas the hip hinge is more of a hip exercise. And you can progress the hip hinge by adding some weight. I'm using a 10 kg kettlebell here. 2 or 3 sets of 10 is a good amount. As a progression, you can do a hip thrust, where you quickly thrust the hips forward and the momentum then carries both arms with the weight forwards like a pendulum. Just remember to concentrate on the hips producing the bulk of the movement and not the arms. Another great functional exercise for snapping hips is the farmer's walk. The idea is to walk slowly and deliberately while holding a heavy weight in one hand. Use a dumbbell or a kettlebell, which is equivalent to about 20 to 30% of your body weight. The important thing is to avoid leaning away from the weighted side. Try to keep a nice neutral posture, and of course, there should be no snapping of the hips. Next up are a series of stepping exercises. Use whatever height you can manage without symptoms. The first step on your staircase will be a good height to start with. So, the first is a step up. Lead with one leg going up and then the same leg going down. Then swap sides. Now try a step down. Go slowly and keep control. Don't flop down heavily. I'm stepping down with my right leg here, but it's my left hip that's doing all of the work. Don't forget to swap sides. Now, try a side step like this. Again, go slowly and carefully and alternate sides. Finally, and only if you can manage it without pain, you could try a lunge thrust. This is a plyometric exercise that aims to load and then unload each hip rapidly under control. About 3 sets of 30 seconds is a good start. Now, this final exercise is one of the most important ones. It combines hip control with balance, and it works all the important hip and gluteal muscle groups. Start by just trying to balance on one leg. Keep your knee nice and soft, not locked out straight. I tend to do this barefoot, but you could wear lightweight sports shoes if you prefer. Use a hand on a wall or a chair to intermittently correct your balance if you need to, but you should be aiming to manage without any hand support for about 30 seconds. If you can do this easily, then start to lean forwards a little like this, and then return to the starting position while keeping balance. Then go as far forwards as you can manage. Even touching the floor with both hands if you can. Okay, so that's a comprehensive set of exercises suitable for snapping hip syndrome. They might take a few months, so be patient. And if you can't do some of them at the start without causing the snapping, then don't worry, just do the ones that you can do and then try again in a few weeks. As you get stronger, the snapping should reduce and hopefully fade away completely. And eventually, when you can do all of these exercises without causing any pain or snapping, then you should now be at a level where you get very little symptoms during normal everyday activities. If you're then wanting to return to a particular sport, then you might need to introduce some sports-specific exercises, and these will really depend on the particular sport that you're doing. So hopefully you can use some of the concepts demonstrated in this video to help devise your own specific exercises that challenge your hip in your sport. Or you could see a coach for advice. If you're a dancer or doing martial arts, then I'm sure that they will have seen snapping hips many times and be able to advise you. Okay, well that's about it for this one. Thanks very much for watching. Take care and bye for now.